All right. Well, we are here another fantastic Monday morning in the middle of AEP. Thank you guys very much for your time and attention during this busy season. We really appreciate you taking the time this morning. Just a very, very quick reminder, this is the last time we are going to be meeting here at Ring Central. We have a brand new meeting link that we will start next week on Monday, and I'm going to put it in the chat here. And those of you that are on the road, if you don't have this link, please reach out to us at support@askhpm.com and we will send over that link. Make sure that you save that link. And what it's going to do is it's going to take you over to this web page here to register for all of our events that we have going on every Monday morning. Okay, so it's a webinar setting. It's a new platform that we are using for Zoho, and it's going to give us a lot more functionality, as well as allow us to do some live streaming with YouTube and Facebook. So if you prefer to be doom scrolling on Monday morning, you can go ahead and jump on one of our calls as well. So I want to make sure that that is clear, and because we are not going to be using this link next week. This is the last call on Ring Central. So please make sure that you save this link that I just put in the chat and what you see on the screen there moving forward. So with that, our mission here at Health Plan Markets is to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And in order to maintain our expertise, we have to keep one foot in the classroom and the other one in the field at all times. And you are now looking at our HQ platform. Under the training calendar, you would go to Learning and click Training Calendar, and this is what we've got going on throughout the week, this week, the week of the 18th. So later today at 11, WellCare is doing an AEP refresher in English. That's at 11 o'clock today. AvMed's doing a 101 training for OEP, for OE rather, not OEP. This is for the individual and family plans if you are selling those products on the marketplace. 1 o'clock, we've got United doing CSNP training. 3:30, again, WellCare is doing their AEP refresher training in Espanol. Moving over to Tuesday, we've got Cigna doing their open office hours at 9:30. Devoted's got open training at 11. United Healthcare DSNP training at 1 o'clock. Spark's doing DSNP and LIS training at 2 o'clock tomorrow. And then if you need a little break, Cigna's doing a happy hour over at Brewlando. I guess some people are getting burnt out and they need a drink. So there you go. Happy hour tomorrow if you're in the Orlando area, 5 o'clock at Brewlando. Moving over to Wednesday, you've got AvMed doing a Medicare benefits training at 9 o'clock on Wednesday. Our very own Al Clancy is doing a virtual coffee and chat at 9:30 to 10:30. Again, if you feel lost, confused, or you don't know what to do next, Al is a great resource to reach out to on Wednesdays. We also have coffee and chat with the UHC broker manager, Adriana, at 10 o'clock on Wednesday. So she'll be available at the Edgewater office here in Orlando. Also at noon on Wednesday, we have rolled out a brand new product from United Healthcare. This is the ancillary products for hospital indemnity, dental vision, and short-term, long-term products as well. So check that out if you haven't already. That is on noon on Wednesday. We've also got 4 o'clock RMA and Devoted. This is a provider group. If you're in the Osceola market, you can check out Dr. Torres is going to be opening his office, and that is sponsored by Devoted. You can check out a mixer there on Wednesday. Thursday, we have WellCare coming into our office every Thursday throughout the rest of AEP. And we have Susanna, who has been gracious enough to lend her time to be here on Thursdays, every Thursday for you from 9 to 11 to answer any questions that you have about WellCare, because they have one of the hottest core plans in the market, and they are very strong with the DSNP, not to mention their longevity in this business as well as the network. So please pay attention to what they have to say today, because I think a lot of you may be missing out on some sales from WellCare. Also at 9, Simply is doing a virtual training on how to navigate SEPs. Always important to know how to do that. Jarvis training is at 11 for United Healthcare. Noon, you've got Cigna doing office hours. There's UHC dental and vision and hearing training, 12 o'clock on Thursday. And then 3 o'clock, this training for our portal is available every Thursday at 3 o'clock. So if you need some help navigating, we've got that. Friday's a little light, but we've got AvMed doing their Medicare enrollment platform because they are not on HPM Shop. You will need to know how to use their enrollment platform to do that. They're doing a demo on Friday at 9. And then what about HPM Shop with our very own Tom Ryan available to help you navigate how to do Medicare enrollments from what we've got here at HPM. So 9:30 to 10:30 there. So that's your training for the week. I know that was a lot, but remember guys, it all lives in HQ under learning, under training calendar. So it's all there. Pick the one that you've got. And I will say, even throughout AEP, I know it's tough sometimes to, spend some time or invest in training, but as a general rule, if you're not going to at least one training, one networking, one mixer, whatever it is per week, then you could be missing out on some serious opportunities. So please pay attention to that. Okay, shifting gears. We have an AEP contest that is locked and loaded. Fernando has put in the AEP contest numbers. There's a banner up top at HQ, and that will bounce out and show you the contest leaderboard. So we have some leaders that have already secured their trip to either Cartagena, Costa Rica, or Dominican Republic. And these are the folks that are really crushing it this year over in AEP. Remember, this is a point-based system. We've got the full video here, explanation, and the contest rules as well as how do you get on the trip. You need 60 points. It's important to know that. Which carriers will give you which points. It's either 1 point or 2 point for this year, and it'll get you on to the trip. Okay, so you can check that out. Again, it's on the very top of HQ to see where you are as far as the contest leaderboard. We're going to be updating this once a week, so if it's a little off, that is expected. But you can actually search for your name there if you want to, and you can find out where you are in the contest. Moving to ACA, happy to announce that Oscar is back in business with Health Sherpa. In case you haven't already bumped into that, Oscar has renegotiated their contract with Health Sherpa, so they are now back on the enrollment platform, and they have been swinging for the fences. So they've got some really fantastic products this year moving into 2025. Very low bronze plans, excellent silver plans, and expanded bronze as well. So one thing to note about Oscar is they are tech forward. They've got a great app, great virtual assistants when it comes to that, medical care. And then as far as network is concerned, very strong network with an EPO allowing you to go wherever you want inside that network without referrals, which is rare these days, especially if you're in metropolitan areas. So check that out. Wanted to make sure that everybody was aware of that because one of the major concerns is how do I do my Oscar enrollments? Well, it's back on Health Sherpa, so no need to worry there. So there we go. Also want to add that under Health Sherpa, there is a fantastic section, the FAQ section. It's what's new. So anytime that they launch a new feature or a new product or anything like that, such as their enrollee assistance program, you can learn about this and understand it in order to best serve your clients and to make sure that you're not missing out on anything. So the Enrollment Assistance Program, which was formerly known as a referral program, especially for those of you that had to refer your business for Florida Blue. As you know, Florida Blue is a captive gig. You cannot write that particular policy unless you are captive with Florida Blue. However, with Health Sherpa, you can refer it in and you'll still get compensated for it. So that referral program is now called the Enrollee Assistance Program. If you haven't done that yet, it is a sticky wicket. You do have to sign up for it. You do have to sign up some additional paperwork, and there's some extra steps that are needed in order to refer business to specific carriers under the Enrollee Assistance Program. So you can learn more about that on Health Sherpa's frequently asked questions section, and everything from the resume link which went live. We talked about that before, and as well as any articles that they're popping up as we move throughout open enrollment as well. One thing to note on HQ, I want to pop back here. We are posting all sorts of articles throughout AEP and beyond. So we did talk about that resume link. And so I wrote a blog article that kind of breaks it down a little bit easier for you. So these particular blogs are listed on our homepage on HQ to keep you up to date. We are attempting to jump your inbox, meaning that we don't want to be another person that's jamming up your email. So in order for you to get the most accurate information, please make sure that you're coming back to HQ and getting the most recent updates here. Okay, we are working on notifications at this moment, but for now, just set a timer maybe after this call that you're going in there and checking all the blogs that we wrote throughout the week so you know what's going on out there as well. Want to talk about what we're seeing out there as far as trends are concerned. I'm going to stop sharing my screen just for a minute. This past season, or the season that we're in right now, moving into 2025, we've seen quite a few trends moving away from PPOs. And I want to talk about why that's happening. And I'm sure the folks at WellCare can chime in on this too when they get a chance. And PPOs, especially with markets that are saturated, that have provider groups that are very attuned to managed care, are not fans of PPOs. Now, why are they not fans of PPOs? Well, the biggest reason is the member can go wherever they want, whenever they want, without permission. And so that makes it very difficult for provider groups to manage care when you have no control of your membership. So if a member wakes up and says, hey, I want to go to the endocrinologist today, and oh, by the way, they're at a network and my primary care doctor has no relationship with this individual, I'm just going to go do my thing. Now, the plan will cover the cost of it. That's not a big deal. But the managed care provider, the MSOs or the IPAs, find it very difficult and very expensive to manage that type of member. So we're seeing a trend of PPOs backing off in certain markets. We're seeing trends of them leaving or closing. We're seeing trends of them making them non-commissionable. And we're seeing this trend in areas that have high concentration of provider groups that have managed care contracts. Okay. Now, I'm not here to tell you that PPOs are bad or evil. I'm just here to let you know why things are happening the way they are in certain markets. Okay. Now, PPOs have fantastic benefits. Obviously, for somebody that travels a bit or does want that flexibility or has several doctors that don't match up any network, PPRs are great for those types of folks. But if you're living in a metro area like Tampa, Orlando, Miami, it's going to be really difficult for a provider group to have a member that can go anywhere they want. So that's why HMOs, if you will, are being pushed by the carriers on the Medicare Advantage side in certain markets. It's not because they want to specifically. It is cost effective. It is a profitable business model, which is important, but it's also being driven by the provider groups as well. So I wanted to say that because I think it's a good segue into why you should be selling WellCare, because WellCare has fantastic HMO products. They have fantastic MSO and IPA relationships, and they have unbelievable benefits for this year that may have been overlooked. So with that, I'd like to again reintroduce Susanna from WellCare. We've got Danny as well, and the head honcho, Joey Anselmo. So Susanna, if you want to reintroduce yourself and give us the good news about WellCare today.
Hi, good morning.
Good morning.
How is everyone today?
I think everyone is fantastic. They're on do your thing.
Okay. So let me start presenting.
Okay, you should see a little share button on the bottom there. There you go.
Can you see the screen?
Yes, ma'am. Good to go.
Okay. Perfect. So I would like to introduce my team. We have all of our broker managers here for the whole state of Florida. In Central Florida, we have Daniel Maldonado, Maria Diaz, Arturo Acevedo, who covers Lake, and myself, Susanna Sanchez. So we're here to support, and if you guys have any questions, please feel free to reach out. Any of the people that are here in this screen, we're more than happy to help. So for our Florida, we want to let you know that we have a strong provider partners in our network. We have a strong dental and vision packages. We have a strong formulary. For 2025, we have a new plan. It's called WellCare Patriot. It's an MA plan. It is really good. It is fantastic for our veterans. And we'll go in more detail about that. For our plans and the duals, we have 0 on our PCP, also for our simple plan. And Danny's gonna give you more details on those plans as we go along with the presentation. These are our dental packages. We have a very, very strong dental this year on all of our plans, including implants on some of the plans that we're offering. We use DentaQuest as our provider vendor. We also have the Welker Expandables, and I just want to remind you that for our DSNPs is rolling. That means that they can accumulate some of that money and roll it over to the next month. For this year, we are going to be using the card for gas, to purchase food, for OTC. Something new that we have this year is that we can also buy home improvement and safety items. Again, we can use it for utility assistance, rental assistance. We are no longer using it for hearing, vision, and dental like we have done it in past years. That's not gonna be happening in 2025. For our OTC, that one will not be rolling. It's only for the DSNPs. That's the monthly rolling card that we're gonna be able to use. Some of the vendors that we have is Walmart, Amazon, CVS, Walgreens, Winn-Dixie, Fresco, Bravo, and many more that we can teach you how to look up in the system. And then Danny's gonna explain and go over some of the details for our plans. Right now we're showing you the simple plan. Danny, go ahead.
Good morning, everyone. So now, good morning. So we have here the plan, the push plan in Orange, Osceola, and Seminole, the Wilker Simple 213 for Orange, Osceola, and Seminole. Remember, in Polk County is available with the implants as well. But here in Orange, Osceola, and Seminole, this HMO plan have a 2,000 MOOP, 0 in specialist, 0 in PCP, $50 for inpatient for the first 5 days, and then from 6 going forward will be 0 in consecutive days in the hospital. ER is 2,500 per year, so it will be a total of 5,000 in hearing aids. That is awesome. It's a lot. It's a great amount of benefits in the hearing aids. Also, in the vision is 600. This is huge. So when you see this plan is very competitive in the market. So again, 0 in PCP, 0 in specialist, 50 inpatient, 5,000 hearing aid, $600 for vision. And the dental is the platinum, no max allowance. This is the plan that covered the 2 implants, 3 crowns, 3 root canal, 8 extractions, and many more other benefits that are covered, like deep cleaning, bridge, fillings, and other benefits that are covered in the codes and all that. By the way, if you guys need the codes, we can send it over in an email. It's available in the WellCare 2025 AEP Readiness Resources. You can find all those codes there. I can show you how to find those codes, or I could send it over an email. So Justin, you can share with everybody in your team. For OTC, this plan provide $285 rolling. Not rolling, quarterly. It's only for OTC. Remember, this next year, 2025, they're going to be able to use the OTC benefits to Amazon.com. So in Amazon, they just need to do an order of $35 or more, so they don't need to pay shipping as long as they do an order of 35 or more. We continue with Walmart. We're going to add Sam's Club for the OTC and the food card as well for the duals. So that is something new for next year as well. And this plan, the deductible and the prescriptions are $420, but it only apply for tiers 3 to 5. Tiers 1, 2, and 6 is zero copay. And remember, since last year, we add the tier 6, and we have 50 prescriptions that we changed to tier 6, so they don't pay copay, so it's zero. So we have a lot of prescriptions there that are covered in tier 6 with no copay. It's very important that you know that. Remember, this is for a beneficiary that don't have an LIS help. So it's for people that pretty much don't qualify for that. Any questions? Any concern? Okay, let's continue with the WellCare Liberty 175. Remember the 175. This is has been a plan, very competitive plan in the market. This plan is available in the entire state, 66 county of the state, and this plan is designed for people that have FBDE, QMB plus, and SLMB plus, so pretty much full duals beneficiaries. As long as they have any level of LIS, they don't gonna pay copay in the prescription that are covered in the formulary. So it's very important that you know that. It doesn't matter if it's tier 1, 2, 3, or 4 LIS. It will be zero copay in all dual plans in Florida. And also, we're gonna have in this plan $1,500 for per year for hearing aids. So it will be a total of $3,000. For vision is $400. And then this plan also have the platinum dental that it had no max allowance, 2 implants, 2 crowns, 3 root canals, 8 extractions, and all that. And also the spendable card is gonna have 190 rolling, so they're gonna be able to use the entire year the visa for food or whatever they need. This year is 180. Next year is going to be 190. So it went up $10. And remember, X-ray is zero. And all duals, the agent will get a $50 HRA bonus for the HRA completion. So it's very important that you know that it's an extra $50 for dual SNPs only. Now we have here the dual access 124 for the entire state as for designed for QMB only. Because remember, this plan next year, they're going to qualify also for the full benefit, full dual levels. However, the QMB is the one that is going to be better for them in a specific, because if you enroll somebody that is full in the access, they're going to lose benefits. So that's the reason we add only QMB for the dual access, and it's going to be zero copays and everything. So, it's a PCP, specialist, inpatient, ambulance, and all that. And then 3,000 for hearing aids, 400 for vision, and the dental. This is different. The dental, this one did not include implant. However, it has a $5,000 amount in the dental plus the preventive care. So when you add that, it's more than $5,000 because the preventive care, like fillings, X-ray, the dentist visit, and all that, is in the preventive care. So the $5,000 goes to the comprehensive, like extractions, filling, bridge, dentures, root canal, deep cleaning, stuff like that. So it's a very competitive plan as well. The WellCare spendable card in this one is this year, 2024, is 170, and then next year is going to be 175. It went up $5, and the good thing is it's rolling, and we are one of the two companies that have pay at the pump, the gas. So it's very very important that you know that. A lot of people, uh, a lot of duals already receive a food stamp, so pretty much they use it towards the utilities and also the gas. So it's very important you know that. And remember, the X-ray or prescription drugs that are covered in the formulary, as long as they have LIS, is zero copay. So just as a reminder, and the HRA is $50 for this one as well. Susana, let's go to the next one. The partial plan that we have available in the entire state. This plan is the same in Miami-Dade. So all dual plans of WellCare next year is going to be the same plans. And the WellCare Patriot, which is the I think it's 239, is the plan that is designed for BA, but it's going to be the same entire state. So from the 6 plan that we have available in the state, 4 will be the same in the 66 counties. So we try to make it easy for you guys so you can sell it easier. For many, many years, we used to have a lot of plans, 13, 11, 9, and then now we're going to have 6 plans for next year only. So it will make your business with us very, very easy. So in this plan 202 is designed for beneficiaries that have SLMB, QI, QD, WI. So in other words, partial. The move is 1,500. It's very good for a partial plan. The co-pays are zero, except ER and ambulance that have a copay. And then hearing aids is $1,000 per year, so it will be a total of $2,000 for hearing aids. $400 for vision, and again, the same dental as the WellCare Dual Access, $124. So this one, the 202, have the same dental, which is the gold, $5,000. Remember, the preventive care is separate from the comprehensive, and then we have the spendable card with $82 rolling. Remember, it's a partial, but they can use that towards gas, food, or whatever they need that is available for them. And then the HRA is $50 for the completion, for the HRA completion. And then the good thing about the HRA bonus is that did not have a chargeback. So just for you to know. Question and answer.
All right. Thank you so much, Danny. I appreciate that. Susie, can I have the screen, please?
Yeah.
Good morning, everybody. I'm showing up as a guest for some odd reason. This is Joey Anselmo. We have lots of exciting things happening, and this simple plan, no matter where you are in the state of Florida, is going to really, really do a great job for your membership, particularly if they need a lot of dental work, right? So very, very low copays with the $600 of vision and the no max allowance dental to include implants. I put a link in in the chat here for the WellCare first look. And so I want to just run that through that in 2 seconds here. Let me share this right quick. Share the first look. It's very easy to use. This when you hit wellcareFirstLook.com, you go to 2025 details, and then you click on the state of Florida. You kids are in, obviously, the Orlando market, but if you're over in Brevard or Volusia, already Lake Marion, Sumter, Indian River, so you're going to go under Space Coast. For some odd reason, they have it under Space Coast. But anyway, we go to Orlando, and then you can view all of your plans. We have an MA-only plan this year called the Patriot Plan for our folks that don't need the prescription drug coverage. But again, looking at the WellCare Simple plan is going to be something that's going to be really, really amazing. $2,000 MOOP with 0 PCP, 0 specialists, $50 in the hospital, 60 trips of transportation, and $285 a quarter on the OTC. But the most important thing is that now we have core plans that have the Platinum Dental, which covers implants. So that's what's really moving the needle for us this year. And so we're really excited. Over in the Polk County area, the MOOP on this is $1,200. So really amazing stuff happening there. In addition to that, we have a party happening. Yeah, we're going to drink too, just like Cigna. So over this Thursday, we have Thursday night football, Miller's Ale House, South Cimarron Boulevard. Can you see that on the screen or no?
No, but we know where that is.
Okay. November 21st, we're going to Miller's Ale House at 5 o'clock, and we are going to have a good time. It's called the Halftime Show. We're just over halftime with the open enrollment period, AEP, so we want to make sure that everybody gets a chance to lighten up a little bit, have a little bit of a good time. And so we're going to be there Thursday night. Last Thursday, we had like 65 people at an Osceola County event. So looking for everybody to come in swinging and have a good time. It's going to be a lot of fun. All right. I know I took up a lot of your time today. We're over schedule. And Maria, Danny, Susanna, Danny, I appreciate you guys presenting today. Thank you so much. WellCare Simple plan, ladies and gentlemen, it is killing out there, and I'm really, really looking forward to seeing you come visit Susanna on Thursdays at 9 and attending the event on Thursday. And we're excited that everyone is here today. Great meeting. Appreciate the opportunity, Justin. Everybody have a great rest of the morning and full day Monday.
Awesome. Thank you, Joey. Thank you, Susanna. And thank you, Danny. I know you guys are extremely busy running at full speed. But if I can't shout this from a mountaintop, I don't know how else to get it through to you guys. A $2,000 MOOP on a core HMO product is unbelievable. 0 PCP, 0 specialist. I don't know how to say that louder. $50 at the hospital. I mean, come on. Unbelievable. So in addition to everything that Joey's just saying, I just want to resonate that, you know, you probably should be leading with this product because another agent's going to come right behind you and undercut you with the same product. So just make sure that you know that WellCare's out there killing it with this plan. So thank you guys very much for your time and attention today. As I want to remind you again that next week we will not be at this link. We will be at the new link that I left in the chat. One more time, I'm going to leave it in the chat. And then it'll take you to a registration page. Please register for that webinar, and it will auto link you to all of the webinars in the future for Monday. So with that, I want to thank everyone for their time. Have a fantastic and amazing week in AEP. Appreciate you guys.
Profitable. Yeah.
Thank you, Justin.
Thank you.
Thank you, everybody. Reach out if you
Thank
need
you,
us.
everyone.
Take care.
Everybody.
Thank you, Justin.